everybody. This is Dr. Casen Maria, and I'm joined with my special guest, Dr. Bob, tonight. And
Thank you for having me.
You are so welcome. Now, we are really excited, especially being October, to share with you about breast thermography, what we're learning, and even in the current research. I know in the last week there have been several articles out there, and I know we're going to kick it off and talk about what thermography is and what it's not. So, Dr. Bob, why don't you start by sharing thermography, what it isn't and what it is?
Well, we want to really start by saying with a disclaimer that we are not suggesting that thermography replaces a mammogram. So, ladies, if you're having mammograms, I would suggest that you may want to continue doing that. But we would like to say that thermography is a different approach. It's really a measure of temperature. So this is what I learned a long time ago about X-ray. It usually takes about a 40% change to occur on a structure to show up on a film. So that means with a breast mammogram, which really is an X-ray, there has to be a change of the structure for it to become radio opaque. In other words, for it to literally show up. What's interesting about thermography, Dr. Casen, it's a measure of function. And it really will be 4, 5, 6, 7, 8 years in advance. Because see, traditionally cancer will grow around a blood vessel. So if you have cancer cells that are growing around a blood vessel, what do blood vessels produce? Heat. So there's going to be a change of a pattern. So when Dr. Casen takes a thermography in our office in Ohio and Debbie takes the thermography in our office in Naples, we're looking for changes of temperature. Would you say that's the simplest way that we could put it?
Yes, and thermography, it's a temperature evaluation of the breast tissue to measure function. And what's really exciting is if you're looking at in here, you can see how there could be other things going on underneath the surface that you aren't even aware of. So a lot of ladies, when they're coming in to do their thermography, they're asking, well, how long before I can do this? And women as early as 25 can start doing thermography. And the reason why is because there's no radiation and there's no compression. And that's a huge benefit for women, because I know now more than ever, women are getting smarter. They're asking more questions.
It's really good.
And they are even creating their own ideas of, hey, I'm doing this mammogram or I'm going down this route and there's these things that keep coming up, but I'm not really getting to the root of what's going on and what the cause of it is. So I know that we've really created strategies in our office nutritionally to help a woman improve not only the breast tissue, but overall function in the body with liver and gallbladder, if you want to talk about that, Dr. Bob.
Well, that's why we have the model. I think this is so significant. So your breast tissue would be right here. And ladies, your breast will drain into your armpits. There's lymph there, and eventually the lymph's going to go to your liver. So what we have noticed with the thermography, and we've been doing this for we're doing it for 6 years now. So we've done it to a lot of people. There's a couple things that we have learned, and this is why we involve our chiropractic practice and the nutritional part of our practice. If your liver is compromised, this is where the liver is at, by the way, for whatever reason, this breast lymph circuit is going to be impaired. So Dr. Casen, who does the thermography pictures in our Ohio office, when we have our lady patients hold their arms up like this, we're looking for congestion. This is so important in your armpits. And if your armpits are congested, we have created a protocol to get that whole system flowing and moving, and it does change. If you're doing what we tell you to do, it'll change in 3 to 6 months. But I want to transition just a little bit more. When someone comes into our office the very first time, we do a basic foundation, and then 3 months later we create that base. We are oftentimes seeing patterns. So I'm going to word this to you. Patterns of fibrocystic conditions, fibrocystic disease. And what we have learned in our practice, we've had great success with this, is we use clear liquid iodine. We ask our female patients to apply it to their breast every day. You could also put some on your ovaries. And we have seen literally a phenomenal response with the reduction of fibrocystic disease. And that is really cool.
And we've seen ladies, I've been working even this past week in our Ohio office, and women, when they come in and I ask about changes in their breast tissue, they say, Dr. Casen, is this possible, but my breasts seem more soft?
Yep.
And I had a woman say squishy, and I said they're more supple because literally your breast tissue needs iodine to
Yep.
support all those tissues. And if you have fibrous or dense breast tissue, those are different things that could be coming up because of a need for iodine. So I want to shift gears, Dr. Bob. Just this last week, this was really significant.
This is big news.
There was a huge article,
Yep.
and it was talking about a woman that went to a museum. Do you want to talk about that?
Well, I think what was going on is that they were using temperature for burglary, so people were not taking things. And so you don't realize that we're always being watched. And apparently, when she went through the scan, she had an increased temperature of her left breast, I think it was.
And it was all red, all right here. And I know she noticed it looked a little different on hers and her family.
And so that enlightened her, and that really was it was around the world. So she had a very, very rudimentary form of thermography that literally creates an alarm, and she started to seek care. So what we do in the practice, what Dr. Casen does, we take, is it 6 pictures?
6 different pictures, but it may be more depending on what's going on in your body. So just this last week in the thermography that we're doing our sessions, and I know we have a couple spots coming up next week, but I have some ladies that have been called back several times with a mammogram, and they say that they're fine, but they still call them back, and they said that they're not abnormal, but they still want to watch it. So I'm able to take additional images with pointers to find out what else could be going on.
So let's go back. She uses pointers. So if you have a suspicious area, now let's just say that we've had people that have come back with suspicious findings. We send them out for 3D ultrasound, and MRI. So we have the pictures that Dr. Casen and Debbie take. They're sent to a group of physicians. They evaluate them. They send us the report. We go through a very detailed history, and then we create a plan. And I think also what's going on right now, Dr. Casen, there's so much information about augmentation and the negative effects of augmentation, and we're getting more and more calls for that. So what about the procedure? How often do they have it done? What's the protocol?
So initially what you would do is you would schedule your initial thermography, and then what happens is in 3 months we do another scan. That establishes your baseline. So us taking the films, what we're looking for is to create a baseline, and the overall thermologists that are reading the reports, they're going to say to us, follow up in a year from now to do your next scan. Or if there's something going on hormonally, which we have seen,
Yes.
I might recommend that they do it in 3 months to 6 months. But there are no risks to doing thermography. So there's no radiation, no compression. It's non-invasive. And it only takes a couple moments to do these images. And then when we get those results back, we sit down and come up with an approach. I do know, Dr. Bob, we've had a lot of ladies that have actually been getting their augmentation and their breast augmentation out because of the side effects of that. So you could be having lymph congestion or other things going on, whether it's from biopsies, surgeries, larger breasts, hormonal health. It's all connected inside in the physiology of your body.
And I also know that we really cannot do any kind of thermography within the 3-month time period of surgery. And I also know historically that we have seen ladies, depending on what kind of birth control they use, high estrogen. So we've had individuals with high estrogen birth control, have them stop that birth control, and their breasts have returned back to normal. Okay.
Also, I do know you can watch us online on YouTube at Drugless DRS, and I've done a session with a woman, and she actually asked and gave me permission to do the Facebook Live and to just see the video of what the whole technology looks like. And we have a lot of videos on our website. I encourage you, look on our website and look at our upcoming Ohio and Florida dates. We would love to have you. You don't need to be a member in our office, so you could be watching us
anywhere in the world.
Anywhere in the world.
Come in and see us.
And come and do your thermography initially, and then in 3 months, and then in a year from now to keep your breasts healthy. Any lasting thoughts, Dr. Bob?
This is so important. We've invested a lot of time and thought process to come up with strategy, so please pass this on. So it's Dr. Bob and Dr. Casen DeMaria. Thank you for joining us.